Assalamu alaikum, hello and welcome to The Health Show, here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their specialised field who discusses the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, we offer an alternative viewpoint from our health experts who attend the show to help guide you in the right direction. If you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. That's healthshow@islamchannel.tv. Today, we're looking at physiotherapy. Now, physiotherapy helps to restore movement and function when someone is affected by injury, illness or disability. It can also help to reduce your risk of injury or illness in the future. To help discuss our topic today, it's a real pleasure to welcome Mr. Shariq Malik, a qualified physiotherapist who has experience working with athletes and sports teams. Shariq is an expert in exercise therapy as well as post-surgical rehabilitation. He is also a member of the Health and Care Professions Council and is registered with most private health insurers. He's well placed to treat a wide range of musculoskeletal complaints. Well, it's great to see you, Shariq. Thanks very much indeed for coming in.
Yeah, no problem. How are you?
I'm great, although I feel like I maybe need some physiotherapy or something.
Yeah, well, we can talk afterwards.
We'll talk about that in a while. But before we talk more with Shariq, let's take a look at a short clip where the referee's whistle. At the referee's whistle, a young footballer on his crutches leans forward and kicks the football with his only leg. This is the beginning of a match between war amputees in Syria's battered northwest.
In this amateur stadium in northern Syria, an unusual football team holds daily practice. Some are civilians, others rebel veterans, but all players have one thing in common. They lost a limb in Syria's devastating civil war, which has claimed some 340,000 lives. The training takes place in Idlib, the last northwest province not controlled by the regime of Bashar al-Assad.
There are many difficult things, such as running, or when you sometimes see the ball in front of you but aren't able to follow it. Sometimes the ball passes in front of me and I want to shoot with my left leg, only to realize that my left leg is amputated.
The team trains 3 times a week for up to 2 hours per session. A physiotherapy center brought together 19 amputee patients for the initiative. Abdul Qadir is a rebel veteran from Homs. In 2015, he lost a leg while fighting near Aleppo.
With the training, I started doing things that I could not do before, like lifting a gas can, things that were difficult. I feel my body is stronger than before. I've started to be able to do more things at home and outdoors.
Today is game day. The charity group, Shafaq, organized a friendly exhibition match.
The care center had the idea to train them psychologically and mentally. We have reached a good level. The next step is to take them to the gym. We will train at table tennis and finally we will go to the pool.
The physiotherapy center has already treated some 900 people suffering from broken bones and lost limbs. Their objective, restore the patient's bodies and their spirits.
So it was really interesting seeing that, because we often associate, don't we, that physiotherapy with people who've been injured, such as the pictures that we saw there. How much of physiotherapy for you is involved with people who may be rehabilitating after an injury, maybe it's a car accident or other things?
Yeah, pretty much majority of the patients that I see are post sort of injury. I'd probably say 95% of the patients that I see are of that caliber.
And what's actually going on when you're rehabilitating someone? Is it because the muscles aren't working anymore, you need to get them working? How does it work?
It all ranges from different issues. So you can have muscles, joints, ligaments, walking, you name it. So a lot of people have a misconception that it's just muscles, but we're looking at the whole body, head to toe, and there's many factors, even posture, biomechanics.
And at that point,
as soon as you stood up straight, yeah.
Let's get back to the real basics. What exactly is physiotherapy? We hear the term a lot, but sometimes maybe we don't fully understand it.
Yeah, physiotherapy is like it's a broad term. where we use many different techniques. A lot of people just think, oh, it's just a bit of massage. It's a lot of exercise. It's a lot of manual therapy. It's a lot of mobilization, as in walking, and a lot of education in terms of treating injuries.
And obviously, for people who have gone to the extreme situation we saw there, where they've lost limbs and things like that.
Yeah.
What are you doing there in terms of helping them readjust to maybe a complete different lifestyle that they're going to have?
Well, with those guys, there's actually a specific type of physiotherapy called Amputee Rehab. So you'll be sent to someone who deals with prosthetics, getting them back to just normal daily activities such as walking, sitting, standing, going upstairs. That would be their goal, really, just getting back to some sort of normality.
You said earlier it's not just massage, it's many other things. So give us an idea of the type of things that you're going to do in a physiotherapy session.
Sure. So some of our techniques are exercise-based, so giving you a home exercise plan to treat your injury. It could involve either some stretching or strength and conditioning, depending on what we find your issue is. There's joint mobilizations where we actually move certain joints in different ranges of motion, and other things are such as awareness and education. And that I'd emphasize on the education part, because most injuries are through education and prevention as well. And
it's interesting that you deal with a lot with sports people and athletes, and that's where they're really putting their bodies under exceptional circumstances.
Yep.
So in that situation, I'll come to the education bit in just a second, but with sports people, what are you doing there? Because is a lot of it prevention?
It's a bit of both. So, for example, if you're dealing with high-level athletes, a big part of their regimen is recovery. So if they have back-to-back games, they've got a lot of competitions coming up, it's a lot to do with speeding up the recovery. And sometimes just getting them ready for a big event or for a long season. So it's a bit of both.
Now, coming back to that education that you were talking about, the trouble with most ailments, as we've discovered on this show, people tend to only get in contact when something's gone wrong.
Correct, yeah.
They've got back pain or something like that, and we'll talk about some of the reasons people come to you in a moment. How much of an uphill battle is the education part to help make sure that people are preventing issues in the first place?
Yeah, I mean, the amount of times that I've drilled it to patients that education, this is what you have to do. If you have an understanding of your injury or what can cause an injury, that's half the battle. So if you know, right, I'm not supposed to be doing this because it can cause that or it can hinder my rehab, already you're progressing yourself.
And looking at the type of things that people will come to you for, what are the most common complaints for people who are maybe not sports people?
People of a non-sporting background can range from muscular strains, people who have low fitness level who attempt to do some sort of exercise can often push themselves too much and then injure themselves. Poor exercise technique, a lot of desk workers, so people who've been sitting in bad postured positions for many years and then start to develop pain. And then unfortunately there's certain people who have had like some sort of trauma, so like a road traffic accident or a slip or a fall. They've had surgery and then they need some sort of rehab to get them back to how they were pre-injury.
And how do people normally get in contact with you? Is it via their GP? Is it privately? You know, how would they normally come to you?
So through physiotherapy, there are two alternatives. You could either go through the NHS options, getting in contact with your GP, or if you've been admitted to A&E, you're going to get the physiotherapy in wards anyway. In terms of if you want to speed up the process, there's always private options. Going to a physiotherapist who's qualified in the specific condition or ailment that you have, and seeing a physiotherapist privately. So you've got two options.
And what about the difference between physiotherapy and many of the other treatments that we hear? We've heard of things like chiropractic, osteopathy, craniology even. I mean, there's a huge amount out there. How does someone decide which treatment's going to be the one that they need to have?
Yeah, that's a good question. I get that asked a lot. What I would say is physiotherapy has the most scientific evidence base behind it. So with it's going to sound like I'm bad math and chiropractors, but there's not too much scientific evidence behind chiropractors, and they just mainly deal with the spine, whereas a physiotherapy, we look at a patient holistically. So muscles, joints, ligaments, even the psychosocial aspect of a patient, such as, sometimes psychology plays a big part in terms of rehabilitation.
It's interesting, isn't it? Yeah, that whole the brain power, being able to deal with something. Let's start from the beginning. Let's say someone has, say, lower back pain. I mean, that's a very typical problem, especially as people get older as well. And they don't know what the problem is. They just feel this pain and they get referred to you by their GP. What's going to happen next?
So we have to find out. Well, we'll do a subjective question, a part of our initial assessment. We find out how long they've had their pain for, whether a specific incident that caused their pain, because this is going to depend on the treatment. So if there's a big difference between someone who's had back pain for a year or someone who's started to feel pain for 6 weeks, and just breaking down as to what the root cause of the back pain is, and that's going to vary our treatment.
And how difficult is it to determine that? Obviously, you've got the time period, but especially if someone maybe has had this pain for a year, and we talk all the time on this show about people who put up with different conditions for way longer than they should. They don't go and consult an expert. But for those people who maybe have had a pain for a long, long time, how are you able to determine how that pain's come about?
Yeah, so there's many questions that we ask. So the type of pain that you're feeling, get them to do certain movements, get them to explain their daily routine. And these are all types of clues that we're trying to paint a picture as to what could be causing that pain. Now, this will all vary within the physio that you have. And again, the more experienced the physio is, the better diagnosis he can give you. But at the end of the day, we're human. Sometimes it's trial and error. And we have to kind of rule out things. We can never be 100% certain that this is what you have that's causing your pain, but we can quite narrow it down as to this is most likely.
I mean, that's the challenge with pain, isn't it? It's interior, so there's no physical side. If you've cut yourself, you can see where the wound is, you know what to do.
Exactly.
With something interior, inside the body, it's a little bit more difficult. So what are the sort of things you're going to do with someone? Let's say I come to you today and I say, I've had this back pain for about 6 months, and it sort of comes and goes. I'm not really sure. What's the process going to be? Talk me through how you're going to deal with me.
Sure. So I'll probably get you to tell me how much pain you have. So if I were to get you to score it at your worst out of 10, that's always a good indication. If someone's telling me that they're 9 or 10 out of 10 pain all the time, then obviously that's when red flags start appearing and alarm bells start ringing. If there's like a dull ache of 4 or 5 out of 10, then I'm thinking, right, it's more towards this side. Then I'll probably get you to do more objective stuff, such as movement, see how your movement is. And again, that's going to give me more clues if you've got restricted movement or you've got full movement. And maybe other things such as strength, the sensation in the area, even just looking at the patient, just, sometimes how they're standing, whether there's any redness on the skin. These are all clues that are going to give us that diagnosis as to what's going on.
And you said it's a little bit by trial and error. So
sometimes,
what's normally the initial process? One of the things people are sometimes nervous about is, what am I going to have to wear? Am I sort of wearing very little clothing and so on? And I know some techniques, it's a little bit different. So what about physiotherapy?
Yeah, with physiotherapy, so if we are going to be looking at the lower back, it is quite important that we can actually look at the lower back physically. So I think with lower back, you can pretty much wear what you want, as long as, you're able to lift up your shirt or expose your lower back. If you're uncomfortable with that, we've always got same-sex physios, or if it's someone underage, be chaperoned by a guardian or a parent. But it is quite important because that does give quite a big clue as to exactly where the pain is, because even within the lower back, it can be middle, left, right, and again, that's going to determine the diagnosis.
So it can vary, of course, according to the individual.
Yeah.
And then the actual process itself, how long would a session typically last?
Sessions last up to about 30 minutes. It varies. Sometimes within the NHS, you can get about 45 minutes, but 30 minutes is about roughly one session, and you can accomplish pretty much. And a lot of people have the idea that, right, I'm going to go do the session and I'm going to feel instantaneously better already. It's just doing some treatment, and a lot of the recovery is going to come with what you're doing at home, what we prescribe for you to do at home.
So you have to. So it's not just coming along to the session, you'll be fixed. You've got some work to do afterwards, do you?
Yeah, absolutely right. That doesn't mean that you won't come to the session and feel better. However, sometimes the the relief is only short term. So if you go to your GP and he gives you some medicine and you go home and you don't take it, you're not going to see improvement. So you have to follow the recommendations that we're giving you as therapists.
And the actual treatment, I guess it really depends on what your pain is and what the conditions are. Are there sort of averages of how long or how many sessions you would normally have to go for before you're more comfortable?
Again, it's very difficult to say. If we were to talk about just like a muscular strain or soft tissue injury, it shouldn't take more than 6 to 8 sessions. But if we're looking at more chronic long-term pain or different structures such as a shoulder, labral tear, that can be 15 to 20 sessions till you start seeing some good results. So again, depending on the injury, depending on what's affected, your sessions are going to vary in terms of improvement.
And what about the extra work you're doing at home? How much of that is there to do?
A lot. Yeah, a lot. I'd probably say that's the biggest part. So you can't come once a week for half an hour and expect we're good, but we're not. We're not miracle workers. So a lot of the things that we are going to get you to do is a lot of self-rehab that you need to be doing outside of physiotherapy.
And of course, we know that back pain and things like that are sort of very, very big issues for people.
Yeah.
After back pain, what are the other biggest sort of normal day-to-day things that you will encounter from people that maybe not necessarily as a result of trauma or sport?
It's just really musculoskeletal pain throughout the body. So you get a lot of neck pain, a lot of rounded shoulders. So with technology now, everyone's looking down, looking at computers, sitting down. You get knee pain from running, going upstairs, or a lot of manual workers who work as builders and whatnot. There's only so much that the body can take until it starts wearing down. So we do see a lot of these type of conditions as well.
And again, when somebody comes to you and they're presenting with a particular condition, then hopefully they will learn some lessons to prevent that in the future.
Absolutely, yeah.
You mentioned knee pain there, and that's quite a common thing that people will find, especially if they're doing a lot of exercise.
Yeah.
There's quite a lot of thought about different type of running shoe and technique in running and things like that. What's your view on that?
I think running shoes plays a small percentage factor in terms of pain. However, I think it's more of the mechanics of how you run. So as it's important that you're getting normal pattern of running. So you're striking your heel, your toes are lifting off. These are the crucial things. But in terms of small percentage factors, I mean, if you're going to run in platforms, then yeah, it's going to hurt. So we kind of advise suitable trainers. Again, it's not my speciality. You should always see someone who specialises in this type of field, but it's not gonna vary that much.
So this whole thing of buying, £150 set a pair of trainers because they're the excellent running shoes might not be quite up to the hype that they suggest.
Yeah, I mean, it's not gonna make that much of a difference. Just because Mo Farah wears something, it doesn't mean that it's gonna help you yourself.
You're not going to become Mo Farah just because you wear the same shoes.
Absolutely.
In terms of other injuries and things, how age-related is it? Are you that much more susceptible when you're older? And are there more specific issues that you're more susceptible when you're older?
Yeah, absolutely. Unfortunately, as we get older, some of our structures start to wear down. So they're more degenerative conditions. So osteoarthritis, you're more prone to get it once you go past the age of 50. So you do start seeing like random knee pain coming on, aches and pains, and especially if they haven't done any change in activity, they're fit and healthy generally, you can start thinking, right, it might be some osteoarthritis that's giving you this pain.
And obviously that's a little bit of a concern, to say the least, because that's just the beginning. What about some of these supplements that people can take? We hear about rosehip oil, we've heard about glucosamine and other things. What's your view of those sort of supplements?
I feel supplements are exactly what they are. They're supplements. They're going to help in a small amount. It's not going to replace like a good exercise and diet program. Supplements may just give you a small percentage in terms of what you might be lacking or just topping up from your normal diet, but no one should solely rely on supplements. They're just there just to help us a little bit more.
And let's talk about the normal diet, because we hear over and over again on this show about how diet can have a massive influence on things to do with our health. What about our joints and things like that? How much difference does what we eat make to the way our joints perform and back pain and those kind of things?
Yeah, I think in terms of joints, there's not too much evidence as to certain diets are going to cause you more joint pain than others. However, there is a high relation to being overweight with back pain. So if you're carrying 20 extra kilos, there's more strain on your back. However, I personally feel that whatever diet you follow, as long as your weight is within normal guidelines, I think it's not going to affect your health. You get so many different types of diets now.
We've got lots to talk about still in the second half, but just before we go to that, give us maybe just a few quick tips of what we can do, but for people watching, that they can do to prevent getting back pain or other kinds of pain.
Sure. I think the main thing would be movement. Movement is key. We're humans. We're not designed to sit down for more than 8 hours. So try and move around as often as possible. If you're sitting in an office, I'd say once every hour, walk for 5 minutes. Stretching is key. A lot of the time when we're sitting down, our muscles are shortening. So what that means is they're tightening up. So just stretching your back, maybe just bending down and trying to touch your toes, trying to hold that position for 30 seconds. All of these little things help and should reduce your pain.
And should you do more of that the older you get?
I would say so, yeah, because the older you get, you tend to you lose muscle, you become less active, your metabolism slows down. So I'd say you just have to be even more cautious of your health.
Brilliant. Lots more to talk about in the second half, but for the moment, thank you very much. Now, we must stress that should you suffer from any medical problems or have any health concerns whatsoever, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concerns being discussed. Don't go away, as we'll see you right back after this short break. Welcome back to the Health Show, where our topic today is physiotherapy. In the first half of the programme, we talked about how physiotherapy can be helpful for all ages, as well as a range of health conditions such as back, neck and shoulder pain, as well as sports injuries. It can also help with one's heart and circulation. With physiotherapy offering so many benefits, it sometimes begs the question, why would we need to take drugs for help? Well, in the US, marijuana is used and is becoming more and more common among America's elderly community as the legalization of cannabis progresses, with California leading the way. So is marijuana the future? Let's take a look.
Sat in front of her television, this 87-year-old is smoking marijuana. Brenna's evening routine now includes a few puffs on an electronic cigarette to help with her insomnia, and a massage with cannabis oil to ease her rheumatism.
The pain was so heavy, so I decided to, give it a real try. And after a few months, I was able to throw out the Vicodin. And I found that if I took a hit on the vape at night, it made me sleep longer.
This Californian grandma is part of a surging new wave of seniors turning to cannabis. She has even become the face of an advertising campaign to educate the elderly about the use of CBD, the therapeutic chemical in cannabis seen as a natural alternative to drugs.
CBD has been in the news a lot here, the non-psychoactive part of cannabis, because the seniors want to use cannabis. They've heard about all of its health benefits, but they don't want to get high.
Seniors arrive by the busload at this dispensary, straight from their retirement home. Following an information session,
and that's when you're actually putting the cannabis drops into your mouth.
They hit the boutique in search of chocolates, ointments, and sprays. For now, only 3% of Americans over the age of 65 are regular users.
Many older people are terrified of drugs. They don't mind medications, which usually are really bad for you, but cannabis frightens them. It's just a miracle plant. I can't say enough good about it.
Though there are still very few elderly cannabis users, there are 20 times more than there were 30 years ago. A statistic that has not gone unnoticed by industry professionals, who expect seniors to pour tens of millions of dollars into the market by 2020.
It's interesting, isn't it, that when people are in pain, one of the first routes they take is some form of drug. We saw there people using medicinal marijuana, but also people will often be using, other forms of medication rather than taking physiotherapy. Mm-hmm. What would you say to that?
Yeah, I mean, medication is going to help you with your pain, but it's not going to solve the root cause of your pain. So although it will temporarily block out the pain, once that medication wears off, guess what? You're going to have pain again. So physiotherapy is going to help you get rid of that pain because it's going to attack the root cause of that issue.
And, as I said in the introduction, there's a lot of different forms of pain. And it is quite interesting hearing about how it can help with circulation and how it can help with a multitude of other things that you wouldn't necessarily associate with physiotherapy.
Mm-hmm, sure. So even just stretching a tight muscle, what you're doing is opening up the muscle fibers, and straight away you're increasing the blood circulation, increasing the blood flow. I always like to use the analogy of closing lanes or squeezing a water pipe. If you squeeze it hard enough, the water's not going to flow. So you have to let go, and then the water starts flowing again. Same thing with the blood flow.
It's an incredible difference that it can actually make.
Mm.
And how much do people accept physiotherapy as a way of treating such conditions? You said it's got the most scientific evidence,
mm-hmm.
but people might still see it as a bit of an alternative to regular therapies or surgery or something like that.
Yeah, I think from the people that I've come across, people are willing to go through the physiotherapy route a lot more. People are starting to get a bit more of an understanding, a bit more of an education. And I think physiotherapy is a lot more mainstream than the other therapies. So I think in football, for example, there's always a physio on pitch side. So I think that kind of plays in people's head, if they're getting it done, then it must be pretty decent.
OK, well, you talked earlier on about movement in the first half and how movement's really important.
Yeah.
So I'm going to put you a little bit on the spot here. Okay. So perhaps you could give us maybe 2 or 3 different exercises that people could do at home.
Yep.
And we're going to film and watch you. So take it quite slowly.
All right, no pressure.
And then let people see. So no pressures. What are maybe some simple, basic stretching exercises that people can do?
So if I start off with a standing exercise first,
okay.
It's going to help. It's going to help with the posture.
Right.
So a lot of the time...
Now, I'd love to join you, but unfortunately there's not room for both of us on the
That's
camera
all right.
here. It's a real shame. But...
Yeah, I'm sure it is. So a lot of the time with work and whatnot, bad posture, we tend to be slumped in this position.
Right.
So what we want to do is we want to strengthen the muscles at the back. So all you need to be doing is squeezing the shoulder blades back, holding that for 3 seconds, and then releasing. Squeezing the shoulder blades back again, and then releasing. So imagine that you've got like a 10 pence piece in between your shoulder blades, and you're just giving it a good squeeze. So just doing that throughout the day is definitely just going to help bring those shoulders back.
Excellent.
At the same time, strengthen the muscles at the back.
Really nice. Anything else?
I think stretching the upper neck muscles is quite useful. Again, a lot of the time our neck slumps, we're looking at phones and tablets. So just dropping your head down to one side with your opposite hand, clamping down, and then just giving the neck a good stretch down. And again, you can control how much pressure you want. So I can tolerate quite a lot of pressure, so I'm going to be quite forceful with it. And you should be feeling like a nice long stretch along here. It's quite key to hold the stretches for 30 seconds. Because that's what scientific evidence says is enough time for the muscle to actually stretch.
And that's probably great for anyone who's spending too much time on their devices.
Yeah, exactly. Yeah.
So good lesson to us all.
Definitely.
Excellent. Any more?
Yeah, and I think we were talking about earlier on about back pain.
Yeah.
So a lot of back pain is just down to simply just tightness and strain in the back. So a real simple exercise, find a nice hard surface, get flat, and then just bringing the knees up towards the chest. And again, you're just stretching the lower back. And again, holding for 30 seconds. Doing that throughout the day.
And when you can do that watching TV?
Watching TV, if you're cooking, if you're, you name it.
Don't leave things on the stove when you're doing it, though, everybody at home, okay? But we're not advocating that, but leave everything to one
responsible
side
for that.
and then have a go.
Yeah.
So effectively, these are really just simple stretches that you can do, which are going to stretch out that muscle and make it work a little bit better.
Yeah, so the first one's more of a strengthening, the last two more stretches. So I think what we need is a combination of both stretching and strengthening.
Really good tips. I really like that. Thank you very much for doing that. And coming back now to the actual therapy itself, that people actually, it has got too bad, they need to come to you. I mean, should people be coming, even if it's really slight pain, or how bad should it be before they do come to you?
Yeah, good question. I always say just use the rule of thumb. If you've had pain for more than 2 weeks and there hasn't been any direct cause, any specific incident, get yourself looked at. Or if your pain is more than like a 6 or 7 out of 10, you're scoring it that high, definitely get yourself looked at.
One of the things we hear all the time is, I don't want to bother the doctor, I don't want to bother anybody, it'll go away. Can these kind of pains go away by themselves?
The truth is sometimes yes. However, sometimes it can progress into a lot worse. So, like I said, if you're give it about 2 weeks. If the pain does not go, then you'd want to get yourself to a medical professional or get yourself to a physiotherapist.
If you go to your doctor, they're going to recommend a physiotherapist to you. You mentioned earlier on the route, if you just want to go privately, you just feel that you need to have some help from a physiotherapist. Maybe you've been to one in the past and you want to go back. What's the best way to find a physiotherapist and to make sure that it's a physiotherapist who's qualified, who is going to be, you know, the right person for you?
Yeah, sure. Well, a lot of people, they would just go on the internet and find the nearest physio is most common, but I'd suggest finding a physio that specialises in musculoskeletal pain with the type of injury that you feel like you're having. So if you know that you've got knee pain, someone who's probably got like a history with dealing with knee-specific rehab, or if you've got back pain, back-specific rehab.
And that's interesting, actually. You say that, you know, talk about the knee with a history of it. Is there anything genetically that makes us predisposed to certain back problems or knee problems or something like that? So in other words, if you have an older relative who has this problem, is there anything you can do that's preventative, or doesn't it work like that?
There are some causes of pain that do have genetic factors, such as rheumatoid arthritis. If you have it in your family, then unfortunately there's a high chance of you having it. And again, if they've got rheumatoid arthritis in their knee, there's a chance that you may get it. Diet plays a factor as well. But again, these are just factors. It doesn't mean that you are going to have it, but you can limit these things by being on top of it.
And certainly, if you really look after yourself and you do take regular exercise, your chances of getting things going wrong is going to be less.
Yeah, sure. If you're looking after yourself, you're doing everything that's been shown to prove or to reduce the risk, you're definitely going to reduce the chance of getting these things. Again, nothing in life is 100% certain, other than death. But with these things, you can definitely reduce the chances.
One of the things that I liked you talking about earlier on was about exercise, and people who sometimes suddenly take up exercise, and, you know, especially happens in the new year, doesn't it? Where people say, right, that's it, I'm going to go off. What are some of the dangers there that people do? And likewise, people who may be, you know, over-exercise, maybe the people using gym equipment incorrectly, or suddenly going out there like crazy and playing football and things.
Yeah, so there's a term out there called weekend warrior, where they work in the office 9 to 5, and on the weekend they might go out and play sports. Or someone who's been out of shape, they've got real low exercise tolerance, they get into a sport. And because their tolerance for activity is so low, they might be only able to do about 10 minutes of exercise, but they push themselves and do 15, 20 minutes. That causes tissue breakdown and, again, leads to some sort of soft tissue injury.
And that's the problem, is that there are so many people who are just not doing enough exercise. They're just not pushing themselves.
I think it's important just to pace yourself. So if you are just starting off your exercise and just knowing your limits, know when you're fatigued. So even if it's just to start off with 5 minutes and then slowly progressing that by 5 minutes each time you exercise. So build it up. Start off with 5 minutes, add 5 minutes onto your session each time up until you get up to a standard where you want to be exercising.
And if you do go to a gym, make sure that you get qualified help to make sure that you are using the equipment and you're doing things appropriately.
Yeah, absolutely. Especially if you're a newbie to gym, see a personal trainer or physiotherapist. To use the equipment properly, to use the weights properly, and to know your limits. Don't be a hero and lift, don't ego lift, because that's only going to result in poor technique, and then you're going to end up coming to see me with a lot of pain.
And it's quite interesting you talk about ego lifting, because actually there was a little note in my gym recently which actually said it's not about how much you lift, it's the regularity of the lift that makes a difference.
Yeah.
It's the repetition, isn't it?
I'd say depending on what you're training for. So if you're training for more strength, then you do have to be lifting large amounts, but that doesn't mean that you just completely throw your technique off, because again, that will result in injury. But volume is a key factor. So if you were to lift a certain amount 20 times instead of 10, that's definitely going to be more beneficial.
You talked earlier on about people who have injuries or something that, you know, maybe it's a trauma, maybe it's a sports injury. Because you've had that injury, are you then more likely to have a repeat of that injury, even if you do things correctly, even if you look after yourself? Have you almost created a weakness?
Not necessarily. There's only a few type of injuries where if you injure yourself, then you're more likely to get injuries, such as a shoulder dislocation. Once it's dislocated, you are at a higher chance of dislocating again. But with most muscular injuries, once the muscle regenerates itself, it should be strengthened after that, and you should be as good as you were pre-incident.
We keep talking on this show about if something's wrong, for goodness sake, go and seek professional help. And we talk about that a lot. Our viewers will be very familiar with that phrase that we use on the show. For people who are in any doubt that this could actually be massively beneficial for them, they're in pain at the moment, or, which often happens even more often, is the fact that they know someone who's in pain who won't go and see someone. Perhaps you've got maybe a couple of case stories of people who've come to you and how transformative it's been to their lives.
Yeah, so, I mean, just selecting a few off the top of my head, there's been people who've been coming in scoring their pain as high as 10 out of 10. Limited movement, they can only walk for 5 minutes, and then, you know, getting them in and seeing that progression on a weekly or fortnightly basis, bringing their pain down from a 10 to a 7 to a 5 to a 3 to nothing at all, and get them to do full movement, and now they're running and they're back to doing what they were 15, 20 years ago.
And how fabulous that can be done without having to take drugs of any sort.
Yeah, that's the most rewarding part for myself, is to actually see a patient recover without any external factors. And again, medication does have its play in rehabilitation, but never make that the sole cause or the main thing that's going to get you recovered.
We started the show off looking at rehabilitation and people who are maybe disabled through, as in that particular case, it was being in a war-torn region. How different is that work that you do for patients compared to somebody who's just got a back injury? I don't want to make it sound like it's just a back injury, but something that's evolved over a period of time as opposed to something which is quite traumatic.
Yeah, something that's quite traumatic, again, they're going to have different goals. So someone who suffered a life-changing injury, their goal might just be to walk with an aid. Whereas someone with low back pain, compared to them, they've got full movement, full activity, they're just in some discomfort. So again, sometimes just managing expectations and just really just working through them with that.
And what about some other case histories? For example, I know you work very heavily in sport, working with teams and things.
Yeah,
what sort of things have you seen there?
Sure. I work with a lot of people who are, I wouldn't call them bodybuilders, but who are avid weightlifters. They're constantly breaking the soft tissue down, lifting weights, and then treating them. So there's one guy that stands in mind, constant pain as he's doing pressing movements. So pressing forwards or pressing upwards, constant shoulder pain. came into me, told me about his issue. It had been 18 months, constantly pain. He said, enough's enough, I need to get sorted out. And now he's back at the gym, lifting big weights, and he's pain-free.
And that's such a typical story we hear so often, and especially from men.
Yeah.
You know, that they just, oh, it'll be fine, it'll go away.
Yeah.
And they don't deal with that.
Yeah, we do find a lot of men more commonly just tend to ignore pain. But with that, it does have consequences. You know, the more chronic the pain is, the longer it's going to take to essentially heal it or treat it.
So if something's getting progressively worse, it sure as heck ain't going to get any better. So go and seek help.
Absolutely, yeah.
And for people who are maybe watching this at home and they've got maybe a loved one or a friend and they're seeing suffering, how would you convince someone to try physiotherapy?
That's a good question. I'd say look into physiotherapy. So maybe educate yourself. If you're unsure about physiotherapy, you're a bit skeptical. Understand what physiotherapy is, the evidence and science behind it. And if you didn't want to go privately, you can always speak to your GP. Sometimes that you need a doctor to reassure you, like, yeah, go to the physio and at least attend one session. And I think you'll be pleasantly surprised.
As a health professional, how long does it take to fully qualify to become a physiotherapist?
It takes 3 years. So you have to do a BSc in physiotherapy, 3-year degree, and once you finish the degree, you're qualified as a physio. However, it is very, very competitive. After, I'd probably say, medicine and dentistry, it's up there in terms of getting into physiotherapy. So
really?
Yeah, it is very competitive.
And for you, do you still see things that you've not seen before? Do you still see cases that surprise you? And maybe you have to think back a second and think, right, how am I going to deal with this situation?
Yeah, absolutely. You still get cases that kind of throw you off. They might be presenting with these symptoms and you're thinking, right, it's this condition. You treat them and they don't see any improvement. That's when you really start scratching your head. I think those cases are very, very low percentage. And I think what you have to do with them is say, look, physiotherapy isn't working for you. Let's get you referred on either to a specialist or even better, let's get you scanned, MRI. That's the gold standard of actually finding out what the issue is, because it's going to give you a nice 3D image and then hopefully that pinpoints as to what issues you're having.
And when you have an MRI, something could be discovered which is more sinister. At what point does it then become a surgical issue as opposed to a physiotherapy issue?
Usually the consultant would decide. So if it's something like a bulging disc, a physiotherapist is more than capable of looking after that. However, if it's something like the disc is completely eroded, you've got bone on bone, that's when you probably have to go through the surgical route, such as a fusion or getting an actual artificial disc placed. Like I said, we're good, but we can't replace discs, unfortunately.
I want to talk now about ageing, because we have many viewers who are watching who, as they get older, they sort of have those creaks and those pains and things. What advice would you give to them, apart from going to see a physiotherapist when something goes wrong, but on a day-to-day basis, sort of light forms of exercise? You gave us 3 there.
Yeah.
Are there general habits that they could maybe take up that would prevent or certainly reduce their chances of getting pain?
Yeah, sure. So we briefly mentioned earlier on about movement. So movement, and I think just strengthening the areas where you're having your aches and your pains. So a stronger muscle is always going to be a more protected muscle, generally speaking. So if you have strength in that area, it is going to protect the structures around it. So if you've got knee pain or you've got creaky knees, just doing some strengthening, just even going up the stairs 10, 15 times, you're actually going to be activating the muscles. Whereas if you're going to the shops or supermarket, you're taking the elevator up, take the stairs, just making these small little changes where you're actually activating the muscles, I think people should see some changes with that.
And those are great tips, which actually are suitable for everybody. I just wanted to actually finish off with maybe a little bit of something to say to everybody, right, try this from now on, make a small change in your daily life that's really going to help you. Now, I'm not trying to do you out of business as a physiotherapist, but this is something that you talk about with your education. What are your sort of top maybe 3 tips that you give people?
Top 3 tips is always prioritise. We're all busy. But at the end of the day, we have to prioritize our health. So find a time of the day where you have a few minutes to yourself. So some people it's first thing in the morning, sometimes it's after work, sometimes just before you sleep. Find some time to exercise. I'm not talking hours and hours at the gym, just some home exercises, 10 minutes a day is more than enough to get the ball rolling.
Great. That's really, really good advice. Hopefully, that'll be advice that will be heeded.
Yeah.
Thank you very much indeed. And again, we'd like to thank our guest today, Mr. Shariq Malik, a qualified physiotherapist, for coming on today's show and talking to us about physiotherapy. It's been absolutely fascinating. If you'd like to find out further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. That's healthshow@islamchannel.tv. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Well, that's it for now. Until next week, it's goodbye from me. Assalamu alaikum.